And now a special conversation with the president of the Rockefeller Foundation, a sponsor of today's event. The Rockefeller Foundation has been in existence for more than a century. In this time, it has amassed a reputation for convening innovative partnerships and transforming lives globally. The Rockefeller Foundation actually invented the field of public health. The foundation's key areas of focus include ending energy poverty, improving public health, and expanding economic opportunity. The foundation recently made one of its central priorities addressing the widening socioeconomic gap in American society, and all that the gap has made raw and exposed in our society, including the fragility of civil and economic rights in this time. Dr. Rajiv Shah is president of the Rockefeller Foundation. Prior to that, he served as the U.S. administrator of the U.S. Agency for International Development, USAID, under President Obama. Welcome, Raj. Delighted to be speaking with you. Look, I listened to a talk by you recently about the American dream and how it had faded. And today we're talking about, to a certain degree, that American dream and how everyone deserves a chance at it. I'd love to understand your take on this, your dashboard, and what the foundation is doing to address the human condition in America right now.
Well, thank you so much for having me, and thank you for doing this extraordinarily important event. You know, it is a basic human right that everyone should be treated with dignity and be safe and be considered equal in the eyes of the law. And so we're super excited to be associated with this event and with your great work to highlight that for the LGBTQ community in particular. We at the Rockefeller Foundation are very focused on inequality and inequity here in the United States. And we think the COVID crisis has highlighted the fact that, for 40 years, even in a pretty strong economy where labor productivity and wealth has expanded exponentially, most American families have simply not gotten a raise. Where 40% of all American households didn't have $400 to get through a health crisis such as this one, and where the burdens of unemployment, of hunger, and of health threats disproportionately affect lower income, minority, and LGBTQ communities across the United States of America. That's not the kind of country we believe is healthy, strong, and powerful for the long run. And so our goal is to bring people together across left and right, across public and private, to try to address the challenges that are holding back too many American kids and make it possible for every single American kid to aspire to the American dream.
One of the things that's been fascinating is to get a little peek into the Rockefeller Foundation's archives on things that you've done in the past. Now, some of this was prior to you, but I sort of, tie it all up together. I mean, you're the head of the foundation. And one of the things you did was basically help fund some of the places that Harvey Fierstein, Torch Song Trilogy and others did their work. You also helped fund a lot of the work that Alfred Kinsey did. And I just want to say it was hard for you to do that because being lesbian and gay in a lot of the country was illegal at that time. I'd like to get into your head a little bit and ask, what does it take for an institution to go into uncomfortable territory, as you've done in the past?
Well, as you point out, I can't personally take credit for these things, but I'm so proud to be associated with an institution that has really been courageous on behalf of inclusion and the expansion of human rights since its founding in the early 1900s. John D. Rockefeller had, inspired by his Northern Baptist faith, a real focus on racial equality from the get-go. And we've made grants over the course of more than 100 years to help establish so many leaders and institutions in that context. And we see the struggle still ongoing today in the Black Lives Matter movement, which really does capture and need to represent all of us. We similarly, as you point out, have made some of those early grants to folks who became great leaders in different fields that had LGBTQ backgrounds, like Harvey Fierstein. And I think what it takes is just a willingness to look around at society and say, where is there injustice, and where can an institution that has an endowment that is somewhat protected from the whims of fundraising and that exists for the betterment of humanity. That's literally our mission. Where can we be brave in taking some actions that will help vulnerable families and that will help put our thumb on the scale on the side of justice and equality? And we do that every day. I'm proud to associate myself with a couple hundred amazing teammates who really believe that that's our purpose and are willing to take risks to make a difference.
Now I want to get into your personal background a little bit, at least in the Obama administration when you were running USAID. At that time, you were the first agency, and you were running the first agency to make discrimination against LGBT people, against your code, against your law, essentially. And you were the first. You broke in that. This last couple of weeks, we saw the Supreme Court make a decision saying that you could not fire people because of their lesbian, gay, transgender, or on the basis of sex. I'd love to get your thoughts on that, because in a way you kicked that door open officially in U.S. government circles, and now it's come full circle to this Supreme Court decision.
Well, thank you, Steve, for mentioning that. I think the Supreme Court decision is such an important landmark that so many decades after Stonewall, to actually say that discrimination against the LGBTQ community simply will not be tolerated under our law is an extraordinary statement. When I ran the USAID, as you know, USAID is proud to provide maybe $20–30 billion of grants and contracts to partners around the world to advance efforts to expand human rights and address poverty and injustice, improve health, and fight pandemics. We made the very simple observation, I believe in the fall of 2011, that none of our contractors or grantees, we would not tolerate discrimination against the LGBTQ community at that time. And it was, I was frankly didn't think it ought to be a controversial thing to say in 2011 that, government contracting should be part of the solution, not the problem. And I'm glad that we were, the first ones out of the gate on that. And I'm really proud that President Obama and Vice President Biden kind of issued an executive order thereafter, making that the standard of all of the United States government, because we have to lead with our actions. And when we're in positions of leadership, we have to demonstrate courage to fight for those who otherwise, are discriminated against.
Raj, in our last couple of minutes, I'd love to just get your insights into how the Rockefeller Foundation uses its enormous heft. It can't solve everything, but it tries to move things. And we're taking a particular focus today on communities of color. And when you look at the economic consequences to being in the wrong zip code, or having, being from the wrong ethnic group, and then you add to that whether you're Hispanic transgendered or Black transgendered, the violence and the loss of economic opportunity that members of the transgender community have. I hate to do it in such a short way, but to get your insights on how these social challenges can be reversed. What can a big foundation bring, and it's not just you, but others, bring to social change?
So the very first grant I made as president of the Rockefeller Foundation was to help Mayor Mitch Landrieu take down the Confederate statue of Robert E. Lee in the middle of the city of New Orleans, because that was the right thing to do. More recently, we've launched a major effort to help American states, cities, and the federal government dramatically expand access to testing so that we can get ahead of this coronavirus pandemic. And what we found is that, in particular, in low-income communities, in African-American communities, in the LGBT community, which is disproportionately represented amongst essential workers in the United States right now, they were not getting access to testing. They were not getting public health messaging in a manner where local community leaders were engaged in communicating the right health messages. They don't have always access to healthcare, and discrimination in the healthcare system in terms of access is a huge issue for the LGBT community, and is exacerbated by the current crisis. So we've helped America get from about 700,000 tests a week to over 3 million tests a week. We're working to get to more than 30 million tests a week by the fall, which we think is essential to protect America's essential workers in particular. And our biggest effort is within that to make sure, whether you live on tribal lands in this country, whether you're in the LGBT community, or whether you're a member of a minority community in the Hispanic American or African American community, that you get access to the kinds of services that are necessary to protect you and your family during this next 2-year period when we're all dealing with the threat of coronavirus.
Look, it's all about the human condition, and I know you're investing a lot in it, and you move the needle as a foundation more than any other foundation I know. So Rajiv Shah, president of the Rockefeller Foundation, thanks so much for joining us today and for supporting today's program.
Thank you, Steve.